So I'm going to get my container out and I'm going to look at it. What am I looking for?
Expiration date.
Expiration date. Holes. Is it all intact? Then I'm going to open it and I'm going to take out my kit. Okay. And then what am I going to do? I'm going to open the first one away from me. Okay. Then side to side. And it's going to open towards me. Going to be remembering that 1-inch border. Okay. Also, because Mrs. Garcia is coherent, I'm going to ask her, because I want to keep her not exposed for as long as possible. So I can ask my patient to, when I'm ready to create my sterile zone, if they will lift up their gown for me. Okay. If my patient isn't cognitive enough to do that, maybe I would have an assistant with me that might help remind my patient, like, okay, Mrs. Garcia, it might be a little uncomfortable, so I'm just going to hold your hand. You know, you can squeeze my hand if you need to, and that's going to help if they go to reach for something because it's uncomfortable. Keep your sterile field. Okay. Sometimes if somebody is really altered and they're really going to fight you, it might take a few people to hold them down so that you can get that catheter in there sterilely. Okay. But here, safety is having a sterile catheterization. So whatever you need to do to try and get it that way. Okay. I'm also going to teach you how to get your sterile field ready at the bedside, and then when you're ready to go between the patient's legs. Because my experience is with students, people that are novices at putting in catheters and sterile field, it takes you a little bit more time to get things ready. So if I'm between the patient's legs for 15 minutes, I have a higher risk of becoming contaminated. Needless to say, they're going to be a little bit embarrassed because you're in the zone for 15 minutes and you're concentrating on what you're doing, but they're like, what's he concentrating on in the zone, or what, you know? So it's a little bit more comfortable for you and the patient to get ready at the side table and then sterilely get your sterile zone made when you're ready. Okay, so that's what I'm going to show you, a little bit different from the video. Now, when you are very confident and comfortable with sterile technique, I mean, I can put a Foley catheter in a patient in about 2 minutes, right, using sterile technique. So I can get my zone ready between the legs and get her done. Okay, so it's not wrong to do it between the legs. I'm just showing you a different way.